Good afternoon. I'm Tammy Epps, and I'm the Director of Media Relations and Social Media here at Prisma Health. Today is National Drowning Prevention Day. It's not a day that we want to highlight because it's a good thing. We want to highlight it though because we want to prevent drowning as much as we can. Prisma Health is South Carolina's largest healthcare system, and we are always looking to give you as much information as we can to keep your family safe. And so today, on National Drowning Prevention Day, we brought you two of our experts to try to help you get some information that you need to help your family. So we have Dr. Kerry Sease, who is a pediatrician based in the Upstate. And we have Dr. Robert Hubbird, who is a pediatric intensivist based in the Midlands. So with that, I'll go with Dr. Sease.
Hey, good afternoon, everybody, and thanks for having me today. I just wanted to spend some time briefly talking about the National Drowning Prevention Alliance 5 layers of protection. And so today is National Drowning Prevention Day. So we want to talk about how are those ways that we can prevent drowning as an unfortunate event. So first, we need to think about barriers and alarms. So it's really important that if you have a pool in your backyard or if you're near a pool, that it has a 4-sided fence with a self-closing, self-latching gate. Ideally, it should also be at least 4 feet high, and a child should not be able to climb over that fence. Other layers of protection outside of the fence, which is absolutely important, is you could potentially have pool safety covers and other alarm systems that would prevent children and unauthorized adults from accessing water unsupervised. So again, barriers with that fence is the first layer of protection. Secondly is supervision. Anytime a child or someone who doesn't know how to swim is near water, you need to stay vigilant and aware of your surroundings. You need to have close contact with that child. They should not be out of arm's reach. And you should have capable adult supervision at all time. You should designate somebody to be that water watcher or the designated adult who is watching the children. A lifeguard is also great, but their responsibility is not just for your child, it's for the entire pool. So you want to make sure that even if you're someplace that there's a lifeguard, that you have eyes on your child at all time. The third is water competency. So every child or adult really should be equipped with the life-saving skill of knowing how to swim. And so enhance your own skills if you are not quite comfortable around the water, but it's really important also that we ensure children know how to swim. This can reduce the risk of drowning and other water-related injuries. So that's a really important thing, to feel confident and comfortable in the water. The fourth layer is to wear a life jacket. So particularly when you're in open waters, we have lots of that here in the Upstate. And so life jackets that are approved by the United States Coast Guard are important. But then also children, even if they're not in open water, if they're not competent swimmers or their water is going to be rough for any reason, then you should have a life jacket on. And then just good emergency preparedness, right? Know how to prepare for an emergency, have basic CPR training, know how to do rescue breaths, basic water rescue, and then also, make sure everyone who's around there knows how to access and have a phone available to call 911. So those are the 5 layers of protection. And so now I'm going to pass it over to Dr. Hubbard.
Hi, good afternoon, everyone. Basically, Dr. Sease told us everything you really need to know to prevent drowning, because that's the only treatment we have. I'm a treatment kind of doctor because I do the children that do badly and have to come to the ICU. But, people like to know what the difference is in dry drowning versus secondary drowning. And basically, when a child is submerged, we like to call them submergent incidents now. When a child is submerged, as water enters the back of the throat and touches the vocal cords will slam shut, preventing the entrance to the lungs. And then as they shut off the airways, obviously the baby can't breathe, the child can't breathe, and they'll start to have distress, and they may go into respiratory failure. Secondary drowning happens is once the child becomes hypoxic or lack of oxygen, and they relax those vocal cords, and water can enter the lungs, and fluid can build up, and that can cause pulmonary edema and lack of ability to oxygenate and cause hypoxia. They'll have trouble breathing immediately with rapid respiratory rate, cough, and they may or may not have altered mental status. And that's that's when we see them in the ED when they're coughing or in congestion and may have some altered mental status.
Dr. Hubbard, I know that you've taken care of lots of children as a lifelong pediatric intensivist. Can you talk to us a little bit about what kind of treatment and what you have to do in the ICU to try to work to save our children?
Well, the biggest problem with trying to save the children after a significant drowning incident is trying to prevent any secondary or further secondary damage. A child that comes into the emergency department in distress and has mild or moderate associated drowning, meaning they are just have a little bit of cough if they're mild, or if they have some, but no loss of consciousness or disorientation. If they're moderate or severe, where they're either disoriented or completely in coma, then they'll be admitted to the hospital. And over the next several hours, usually within about 8 hours, their lung pathology will show up. And if indeed there's been an associated stoppage of the heart where there's no blood flow, then you have significant damage. The big organs that we worry about damage with drowning, obviously the big boy is the central nervous system. And neurologically, patients with a period of time without oxygen, either secondary to having no heartbeat or just having severe pulmonary edema or lack of inability to breathe, then they can have loss of oxygen to the brain, and it doesn't take but just a few minutes to cause significant brain damage. And it can lead all the way to brain death. Obviously, when water floods the lungs, you'll have washout of the normal factors in the lung, and you're not able to obtain enough oxygen to get by on, so we have to go on a ventilator. And sometimes, no matter what ventilators we use, no matter how sophisticated, we can't achieve an acceptable oxygen level, and that causes further damage. And then obviously, when the heart has no oxygen for just a few minutes, it can stop, and that happens in the field or in the ED. And when your heart stops, you're getting no blood flow to the brain, liver, kidneys, GI tract. All organs have significant damage. And so what we try to do is optimize their temperature, make sure they're not hot. We want to correct their electrolytes, the salts in their body. We want to get their oxygen level up using the ventilator or non-invasive means. And we want to support their circulation by giving them fluids or medicines to help their blood pressure remain normal. So that's basically the ICU treatment, trying to prevent secondary injury, especially to the brain, but also to all the other organs.
Dr. Hubbard, one of the things that we've seen on TV before is you see a lot of people like flailing their arms and a whole bunch of movement that shows that the person is drowning. But in fact, what we know now is that that's not always the case, that drowning is kind of a quiet, silent thing. And could you talk to us about the 5 signs of drowning?
Sure. Well, also on TV, they do 2 or 3 chest compressions. Everybody wakes up and goes about their business when they have a cardiac arrest. That don't happen either. But as far as drowning goes, it's not a big flailing and calling, help, I'm drowning. That doesn't happen. Typically, excuse me, 5 signs, they'll tilt their head back, try to keep in order to try to get air. Their mouth is usually at water level, and they're trying to get some air, but they don't have time to yell because they're barely able to breathe, and still pop up and down, trying to get some air and then go back down under the water. They don't typically wave when they're drowning, because when you're in drowning, you naturally try to extend your arms laterally to provide some buoyancy. And so they're not able to lift their arms up to show you. Their eyes, as time goes on, become glassy and empty, and the bodies typically stay in a ladder climbing position, kind of upright in the body, because the arms are out and trying to support and get above area for body. So if you're not watching, you're not going to see a child. You're going to watch for their head to be above water. You got to watch for them, make sure they're not in distress. That's the whole point.
Thank you. I think Dr. Sease talked about that too, about just being careful that somebody is really paying attention. So with that, we'll go to Dr. Sease. Dr. Sease, you know, one of the most important things is, can people swim? You know, at what age should people teach their children to swim, and can older adults take swimming lessons too?
Yeah, so the American Academy of Pediatrics says that you can start swim lessons as early as the age of 1. There are these other classes, baby classes and things. A lot of that is reflexes, and really should not give you a false sense that your baby knows how to swim. But starting at the age of 1, if they're not afraid of the water and are showing some of the developmental signs of being ready, you can actually start true swim lessons. Most children are developmentally ready. They're not afraid of the water. They can actually have coordinated movements with their arms and legs by the age of 4. If your child is 5 or certainly 6 and they have not learned how to swim, it should certainly be a priority for you to teach that child how to swim. And the answer to your question about adults, absolutely. If an adult does not know how to swim, there are adult swim lessons that are out there as well. And as I mentioned previously, learning how to swim is I think, an essential life-saving skill.
Yeah. What is a diving reflex in babies and toddlers, and what should parents know about that?
So that's when you are submerged in the water. You instinctively, it's a mammalian natural instinct, you hold your breath so that, water does not enter into your lungs. And so but that's not like teaching that they're not doing that because I'm holding my breath to prevent that. Again, it's this kind of natural mammalian instinct. And it's a way to protect our lungs. But it is not when you see babies doing that, it's not because they necessarily, again, are doing that because they know to do that and they know how to swim, but it's just this natural reflex. And at some point, unless you know how to swim, right? They don't know how to get up out of the water, take the breath, and go back down and do that. So again, it's just this natural instinct that we have to hold our breath when we're submerged in water.
All right, we'll go back to Dr. Hubbard. So Dr. Hubbard, the question is, I think Dr. Sease kind of touched on this. If your child is not afraid of the water and they jump right in, how can we teach them to understand the danger without making them too fearful?
Well, teaching a child not to not be afraid of the water, but to teach them to treat it with respect is just like teaching a child to do anything. In my opinion, it's all repetition. It's repetition. And there has to be a water watcher, a parent nearby. And if a child starts to run nilly-willy toward the pool to jump in, they have to be told no. And you have to be told, then explain what they can do. And it's just got to be repetitive, because we have to not let them be afraid of the water, but they need to be able to respect the pool and the danger it represents to a child.
Right. So at what the child is a good swimmer. My child went to the YMCA growing up. So, there was a lot of things in place to make sure you learn how to swim because they spend a lot of time in the water. But if your child is a good swimmer, until what age do they need adult supervision if you have a home pool?
You need adult supervision. Really, if you look at teenagers, they need a lot of supervision. But typically, we say they need adult supervision until they're teenagers if they're responsible and they follow the rules. And the rules include, multiple things, including having never diving when they're not supposed to, always having a buddy, swim and supervised by a water watcher, hopefully, only swim sober. And with teenagers nowadays, that's a big deal. And they also need to know not to run around the perimeter of the pool because they could slip and hit their head. And they also need to know not to eat a really heavy meal before they swim because that makes you tired and more likely to fatigue and have issues.
All right, good deal. Thank you. We're going to go back to Dr. Sease. Dr. Sease, so you see the kids in the pool with the little water wings, the floaties. So will water wings or floaty pool toys make my child safer in the water, or can that give them a false sense of security?
Yeah, that's a great question. And I'm so glad that you asked that. They absolutely do give a false sense of security, and they are not approved life-saving devices, right? Only a life jacket that is approved by the Coast Guard is appropriate to be, when you think about it, as being a life-saving device. It can give the children a false sense of security too. And as Dr. Hubbard mentioned, if a child's not afraid of being in the water, but they're so used to just having the floaties on, and then they lose track of that floaty or the noodle or whatever it is, and they don't know how to swim, right, then you're in danger with that. If your child is in the water with those, like in a home pool or at a neighborhood pool, and they don't have a life jacket on, you absolutely have to be in hands reach of that child if they were to slip off of that. So should not be used in place of a life jacket, and certainly shouldn't give you the sense that if they have a floaty on, they're not going to drown.
Right. What about colored bathing suits? Are they more visible in the water? Is that something that families should consider when they're thinking about what bathing suit their child gets?
Yeah, I mean, I think it's an added layer of protection. The neon color, the very bright neon colored ones, like the oranges and the yellows and the bright pinks, are certainly easier to see if your bathing suit is blue or a light color. We mentioned before, right, that drowning is silent. It's also pretty quick. And so, you might not see that that child who's either struggling, or unfortunately, if we catch them too late and they're not struggling, you may not notice it as first, but that bright colored bathing suit is certainly an added layer of protection. And then when I think about that, like in the open water and that kind of stuff, it's easier to see those as well. So certainly not going to prevent anything, but a nice another added layer of protection that you can have, so you can easily spot your child in the water.
I think Dr. Hubbard hit on this, but like we're talking about designated drivers, every pool needs a sober adult who stays focused on watching the kids every minute they're in the water. What would you say about that, Dr. Sease?
Yeah, and you've heard us talk about designated watcher. So we like to use the term water watcher. And so knowing who that adult is, sadly, Dr. Hubbard, myself, we've seen children who have died from drowning, and, an adult turned their back briefly, perhaps, right, or thought somebody else was watching the kid, and that's when it happens. And so designating somebody and knowing who that is, we recommend oftentimes, I think I might actually have one here. Well, I thought I did. It's like a little stretchy band that you can put around your wrist and physically hand it off to somebody else. And so you know that you are the designated water watcher at that time. You shouldn't be on your cell phone. You shouldn't be drinking. You shouldn't be reading a book, right? Your attention should be paying to that child. If you need to go inside to use the bathroom or whatever, that children need to get out of the pool and not be in there alone. Oftentimes you'll see these when people are having parties, backyard cookouts, right? And again, you think, I went inside, I thought somebody else was watching the kids, or we thought all the kids were inside and we were eating and somebody slipped outside. So you need to know, I would, count the kids when you're back inside. And it may seem like we're being, excessive about this, but again, as Dr. Hubbard mentioned, prevention is the only way to prevent the bad outcome of drowning. Once that happens, it's life-saving measures that happen in the ICU. So being vigilant and hyper-vigilant about this is imperative and really, really important. And so being very strict about who that water watcher is, I can't enforce that enough.
Dr. Sease, what about if there's multiple children in the pool? We're saying that the designated water watcher, what if there are, multiple children in the pool? Do you need more than one water watcher? How many, what would you think about that?
Yeah, I think that's going to depend on the age of the kids, the level of the swimming that they're able to do. Certainly, I think if it's a party and there's a lot of little ones in there, yes, you need them in there. And if the kids are little, you should be in the water with them. Again, an arm's length away from where you are. So I think that's going to vary, again, depending on the swimming capabilities of the kids. When you're out in open water, like at the beach or something like that, I think multiple people keeping eyes on kids, especially when we talk about currents and that kind of stuff, is going to be really important as well. I think when you have multiple children, some things you need to think about is, how rough are they playing in the pool? Are there rafts or other like floaties? Kids can get trapped underneath those as well. So you just need to be really careful what they're playing, how they're playing, the rough housing, the falling, all those kinds of things. It's no joke around water, right? So we want people to have fun and enjoy it, but you also just need to be really smart.
Yeah. All right, thanks. I'm going to go back to Dr. Hubbard. Dr. Hubbard, so I think Dr. Sease touched on it, talking about being, swimming or boating in open water, like lakes and ponds and rivers. We're luckily in South Carolina, we have a lot of those beautiful bodies of water, but they can be something to be concerned about. What are the tips or rules you would try to give to the community around those?
Well, they're just really common sense rules. For boating, obviously anybody on a boat should be in a Coast Guard approved flotation vest, and only boat when you're sober. And you say, well, that's pretty common sense, but it's amazing how many people go on the water and they're not sober, especially teenagers getting in boats by themselves. As far as swimming in open water, we have the nice ocean and we have lots of lakes, etc., and rivers, but I can't emphasize enough, never swim alone. That's when people get in trouble. And don't swim in rough seas. It makes no sense. If you're in a lifeguard protected area, make sure the lifeguards are there. And then lifeguards usually have notices, and listen to the notices. Look at the warning signs. Are there riptides, or is there bad weather coming? Obviously, speaking about bad weather, you shouldn't be in natural water when there's a lightning storm happening. That makes no sense. And if there's a very rapid current, obviously you're not going to get in that. And then for pools and some ponds, stay away from those drains. The drains or other things and dams that have suction there, you can get trapped with the water coming over and you can't fight your way out for that. And then when you're in a pond or even in the ocean, you got to be aware there may be a depth drop off that you're not prepared for. So those are the basic things.
Well, I'm going to go. I have a question for Dr. Sease. Dr. Sease, the question is, should there always be a water watcher out of the water? And because I know you had said that if it's a small child, you might need to be within arm's length, but should there be a water watcher out of the water too, watching from above the water?
Yeah, I think that's a great idea. I think that would depend on the situation, the number. You can never have too many water watchers. So the answer is yes. I think that's a great idea. I think the most important time to have that water watcher out of the water is when you're transitioning from pool to eating, or pool to inside, right? So that somebody's keeping an eye. Are all the kids out of the pool? Is everybody in the house? And making sure that nobody slips back out, into the pool. Great
so question. We talked about natural bodies of water and we talked about pools, but what about like hot tubs? A lot of families, I know a lot of families who actually have hot tubs on their decks at their house. So what would you say about that, Dr. Sease?
Yeah, so when you're done, cover it, right? Never leave it uncovered. And I would say even the same for like baby pools and little blow up pools that we might have in our backyards. Empty them, deflate them. You turn them upside down if it's a plastic one, because children can drown in as little as 2 inches of water. So fish ponds, all those kinds of stuff, you should have a protective barrier around them so kids can't stumble into them. And when you're done using your hot tub, cover it.
Good deal. I don't think we have any additional questions. Oh, here comes the question. Okay, so it says, I understand that dry drowning is a myth. Can you talk about this? Can people get water in their lungs while swimming? So I thought Dr. Hubbard kind of talked about that, but I'm not sure. Dr. Hubbard, would you want to try that one?
Sure.
Okay, let me go. Yeah, there you go. Go ahead.
Well, dry drowning is not a myth. What happens not infrequently is water will touch the vocal cords, they'll clamp shut, and then the patient becomes unconscious because of lack of oxygen to the brain, and then their vocal cords may or may not unclench. If they don't unclench, you can be drowned without any water in the lungs. Most commonly, though, the vocal cords relax and the water does flood the lungs. But the initial cause of the drowning and cause of the lack of oxygen and all the repercussions is because the vocal cords are clamped shut, not allowing water into the airways to begin with.
So you would say that is not a correct statement then, Dr. Hubbard?
Well, dry drowning is not a myth, it's real.
Good deal, thank you. I think that's all the questions that we have. Let's see. All right, so I'm gonna go back to, well, since you're up there, Dr. Hubbard, is there any additional things that you would like to remind families about when it comes to drowning?
Sure, what I see a lot is little kids less than a year of age. What's the most common place they drown? In the bathtub. They're the lack of supervision, or they're with an older sibling who then wanders off. And less than 1 year of age, little tiny babies tend to drown in bathtubs. And I've seen toddlers, they usually drown in swimming pools, but they can drown in anything. Like I've seen a child drown in one of these 5-gallon construction buckets full of cleaning solution. And I've seen a child fall into a septic tank that was open. Obviously, you just got to be vigilant with children at all times. Like Dr. C says, water's fabulous. It's great to be in, but you got to be watching them every second.
All right, so I'll go back to Dr. Sease. Dr. Sease.
Yep. So I would say, in addition to those barriers and layers of protection, learn how to swim, right? It could be life-saving for you and for your child. So it shouldn't give you a false sense that you don't need to have these other barriers and being a water watcher and all the other smart things you need to do around water. But learning how to swim, I think, is an essential skill for everybody.
Thank you. Thank you to everyone for joining us today at Prisma Health and at our Prisma Health Children's Hospitals. We are here to serve our community. We would prefer not to have to serve them, though, because of an accident. So please listen to all of the great tips that our providers have given to you, and we're here to try to help you stay safe. So thank you for joining us today. Thank you also to our media partners for joining us to help us share important tips to our community. And I hope everyone has a great day. Thank you.